Hi, I'm Nathan Scott, the pelvic health physiotherapist here at Coolgood. For the past decade, I've focused my practice on helping men from all walks of life improve or maintain their sexual function, performance and fitness. Whether that means getting or staying harder, lasting longer, or simply feeling more confident, relaxed and in control. These are all important and completely valid goals. In this short video, I want to give you a clear overview of what's involved in your first appointment, what we assess and how, what your treatment options are and how they work. Because when you understand the process, you can make the best choice for yourself with no surprises and no pressure. Your pelvic floor muscles, especially the ischiocavernosus and bulbospongiosus muscles, play a direct and supportive role in gaining and maintaining an erection, controlling the ejaculation reflex, and increasing orgasm intensity. If these muscles are strong, coordinated, and have good resting tone, they can absolutely enhance your performance and your experience. But just as often, I see men with pelvic floors that are too tense, overactive, or firing at the wrong time. That can restrict blood flow, cause erection loss, and even drive towards an early, uncontrollable ejaculation reflex. So it's not always helpful, and can sometimes make things worse, to follow generic app advice telling you to just strengthen your pelvic floor. That is definitely not always a good idea. This is why we assess. With tools like real-time ultrasound and PelviPower non-invasive biofeedback, you can actually see what your pelvic floor is doing and what it's capable of. Then you can train it in a way that is right for you and can actually make a difference. Yes, that could mean strengthening, but also relaxing, improving coordination, and retraining how those muscles respond during arousal and orgasm. The first time we meet, we sit down for a private, respectful conversation. You don't need to prepare anything. You certainly don't need to share anything you're not comfortable with. All of our assessments on day one are completely non-invasive. We use tools like non-invasive real-time ultrasound, so you can actually see your pelvic floor in action, and the PelviPower biofeedback system, which is a high-tech device that shows you how well you're contracting and relaxing your pelvic floor just by sitting on it. The goal is to help you gain awareness and control of the muscles involved in your sexual function. We offer two advanced therapies here at Coolgood. They're both completely non-invasive and evidence-based. The first is focused shockwave therapy. I know, the name focused shockwave therapy does not sell it well, but don't worry, this treatment does not involve electric shocks. Focused shockwave therapy uses sound waves that converge and travel faster than the speed of sound as they pass through the erectile tissue. This focused energy triggers a natural healing and regenerative response. The treatment is completely painless, quick, and requires no downtime. Unlike medications that work temporarily, focused shockwave aims to restore natural function by stimulating the growth of new blood vessels, enhancing nerve sensitivity, and basically stirring up a regenerative process which helps your body respond more like it did when you were younger. Now you should be aware that there are two different types of shockwave treatment. One is called radial pressure wave, which is a cheaper device that is less targeted, more superficial, and doesn't have the same level of researched effectiveness. I use focused shockwave therapy, the type used in the majority of clinical studies researching the effectiveness of shockwave to address erectile function and treat pelvic pain. The treatment protocol involves 6 sessions over 3 weeks, because we want to repeatedly stimulate the tissue to be in a regenerative state over that full period of time. Over the course of treatment, you're encouraged to be sexually active. Well, there's worse homework in the world. So you're exercising the tissues and so that you're experiencing improvement over time. After the 6 sessions, we wait 4 weeks and then review your level of function. If you're happy with what's been achieved, the process is complete. If there's been a tangible improvement, but you would like to see further improvement, another 6 sessions can be completed. The level of improvement experienced makes an easy decision whether you continue treatment after the initial 6. I'm going to do a bit of a deep dive into the researched effectiveness of focused shockwave and the results you should experience at the end of this video, so make sure you watch that if you thrive on the details. If we find that your pelvic floor doesn't have optimal power and endurance, or it's too tense and doesn't have enough coordination, we can use our PelviPower tools. Non-invasive biofeedback training helps you get in tune with your pelvic floor, so you know how to switch it on when you need it, and just as importantly how to switch it off and keep it relaxed. We also work on how your breathing plays a big role in improving control, strength and relaxation. Magnetic pelvic floor training is an effective way to boost how well your pelvic floor muscles work. And as you can see, the treatment is done fully clothed. The magnetic chair sends focused impulses that stimulate the nerves and muscles deep in the pelvis. We can adjust the position of the magnetic coil to specifically target the muscles involved in sexual function and performance. At lower intensities, the stimulation reaches the sensory nerves, so you'll feel it mostly at the surface. But as we increase the intensity, it begins to activate the motor nerves, which means you'll feel your pelvic floor muscles contracting in a way that's much stronger than you could voluntarily achieve on your own. These impulses don't just affect the local muscles, they also travel up through the nervous system and to the brain. This improves what's called cortical representation. In simple terms, it sharpens your brain's awareness of the control of your pelvic floor. The result is better muscle coordination, improved tone, and greater awareness. And this is important because pelvic floor therapy isn't just about making the muscles stronger. One of the most critical factors in sexual performance is resting tone. This is the level of neural activity in the pelvic floor when you're not actually tensing it. If there's too little tone, blood can't stay trapped in the penis, which makes it harder to maintain a firm erection. And if there's too much tone, it won't let blood in there in the first place. And it can trigger early ejaculation reflex. This therapy helps your pelvic floor settle into its optimal zone, not too tight and not too relaxed. It's especially helpful if you have an overactive or tense pelvic floor, which is something I often see in men with erection or ejaculatory concerns. The magnetic impulses help reset and rebalance the system. So when we combine your home practice with biofeedback training and magnetic booster workouts, you can expect to see better strength and endurance in the muscles that support firmer erections, improve relaxation and control, helping you better time the ejaculation reflex, and enhance coordination, which helps orgasm feel way more powerful and connected. We often pair focused shockwave therapy with Power magnetic training because they work on different but complementary systems. Focused shockwave improves the health and sensitivity of the erectile tissue by stimulating blood vessel growth and nerve regeneration, whereas magnetic training builds better function and control in the muscle and nervous systems that support and coordinate sexual performance. Once you've had your first experience with these therapies, you have a clear sense of how they feel and what they do. From there, you decide how you want to move forward, whether that's with a single approach or combining tools for a more comprehensive treatment. Hey, clearly I think it's a valid goal to have better sexual function and enjoyment in this area of your life. So if this sounds like something you want to start dealing with, just message me directly through the website and I'll get back to you personally. Or you can go ahead and book an initial session. If you're the kind of guy that likes to know what's behind something before you commit to it, this section's for you. Let's take a moment to look at what the research actually says about focused shockwave therapy for erectile function. Most of the higher quality studies use something called the International Index of Erectile Function, or the IIEF-5. It's a questionnaire that helps measure and quantify erectile function. Across multiple studies, men tend to see an improvement of about 4 to 7 points in this scale after completing a course of focused shockwave therapy. A shift of 4 to 7 points can often shift a guy that has moderate dysfunction to mild, and a guy with mild dysfunction to more normal function. This level of improvement is considered clinically meaningful. For some, it means going from needing medication every time to sometimes not needing it at all. For most, it just feels like your body is responding better again and you can rely on it more. So why isn't there full medical consensus yet? It's not because the studies aren't promising, they are. But like any newer treatment, there is still variation in the study methods, equipment, and protocols. Some studies use lower quality machines, others treat for too short a time, or include men with different types of ED where blood flow isn't really the main issue. As a result, some reviews show mixed findings, especially when all studies, good and poor, are grouped together. That's why high-quality, focused shockwave protocols matter, and why I use the same type of equipment and dosage that's shown the most consistent results in the published research. The best results tend to come from what's called focused shockwave, not radial pressure wave therapy, which is more superficial and less targeted. That's why I've invested in true focused shockwave equipment, the kind used in the clinical studies worldwide. The most effective protocol seems to be around 6 to 12 sessions, typically spaced out over 3 to 6 weeks. The energy intensity and number of shocks per session also matter, and I stick closely to the evidence-based parameters. Guys with mild to moderate erectile dysfunction because of poor blood vessel response tend to see the best results. The earlier you address it, the more responsive your tissues are. It's also great for men who want to maintain and optimize the good function they already have. The best way to describe it, if you have no trouble getting hard, then after a course of treatment, you tend to notice the ability to get really hard. So it's an equally valid preventative therapy. It also pairs really well with pelvic floor muscle optimization, especially if you're looking to enhance not just firmness, but also control of timing and orgasm sensation. So how long do the results from focused shockwave therapy last? That really depends on how well you're looking after your body, especially your cardiovascular health. Most men with erectile difficulties are dealing with something called endothelial dysfunction. That's when the lining of your blood vessels, including the one supplying your penis, isn't working the way it should. Poor blood vessel function equals poor erections. Focused shockwave therapy gives you a boost. It stimulates blood vessel growth, improves circulation, and helps restore natural erectile function. But if you want to see those results last, you've got to keep your vascular health in check. That means staying aerobically fit, building or maintaining muscle mass, keeping belly fat low, eating mostly whole unprocessed food, limiting alcohol, and quitting smoking if you haven't already. Simply put, heart health equals heart health. A lot of guys think Viagra stops working over time because their bodies get used to it. But the truth is, your cardiovascular system is probably just declining, and the medication can't do its job properly in a less healthy system. The same goes for shockwave. If you're not looking after yourself, the effects will fade faster. But if you are, and you're proactive about your health, you can use periodic courses of focused shockwave to keep your erectile function strong, natural, and responsive as you age. Think of it as part of a performance maintenance plan. I offer this therapy because I see it help, and because the research backs it up when you follow the right protocol with the right equipment. It's not a silver bullet, and I don't promise results that aren't realistic, but if you want to take a proactive, non-invasive step to improve your sexual health, this is a clinically sound option that can work really well when done properly. If you've got questions or you want to know if it's right for you, feel free to reach out to me directly. I'm happy to chat through it with no pressure.